Welcome back to another episode from MedicMe, where today we will be going through the next steps following a degree in medicine in the UK.
Medicine is widely regarded as a challenging yet enjoyable degree and career. As students, we are approaching a crucial phase of a journey to becoming a medic. Application to medical school. No two medical schools are the same, and a variety of factors can determine which med school we choose to go to, including entry requirements, course length, and location. Once there, however, we will join a cohort of aspiring medical students, and in 5 to 6 years' time, after numerous hospital placements, lectures, and exams, we will have hopefully graduated as doctors. But now that we're finally doctors, what's next?
After studying at a medical school, medical students are given provisional registration with a license to practice by the General Medical Council. However, to practice medicine in the UK, students will generally have to apply to the UK Foundation Programme. This is a 2-year training programme for newly qualified doctors, and it is only after successful completion of the first year that the GMC grants full registration with a license to practice.
As part of the application process, which medical students would usually apply to while still in their final year of medical school, prospective candidates will be assessed using a situational judgment test, the SJT, as also seen in the UCAT exam, as well as the Educational Performance Measure, EPM. The SJT is a selection assignment designed to assess the aptitudes expected of a foundation doctor, as defined in the National Foundation Program Person Specification, and is worth 50% of the final application score. The EPM looks at how medical students have performed academically and will consider additional degrees, publications, and presentations, among other conventional methods, such as the Objective Structured Clinical Examination, also called OSCEs, that students undertake during medical school. In the meantime, candidates are required to rank foundation schools and trusts according to where they would prefer to work for the next 2 years.
The UK Foundation Programme, along with the trust associated, will then allocate approximately 8,000 UK medical graduates to F1 training programmes across the UK. Within these foundation schools, the medicine graduates are given 4 to 6 jobs on rotations over a period of 2 years, which are more commonly referred to as FY1 and FY2. Rotations occur a few times a year, although the most prevalent is always the first Wednesday in August, and this has been designed to expand the skill set of junior doctors while providing an insight into the long-term career objectives and specialities that they may be interested in pursuing. It also provides the opportunity to transition to independent practice, whilst inevitably increasing their earning potential.
During FY1, doctors will apply the key skills and knowledge accumulated during medical school into practice, and throughout the year, the NHS Trust will provide a variety of sessions including foundation level practical procedures, daily teaching, advanced life support training, and shadowing opportunities. At the end of the year, doctors are required to undergo an annual review of competent progression, also called ARCP, which is essentially where a panel will review and validate the educational supervisor's recommended outcome against the foundation doctor's portfolio of evidence. Although the process is not an assessment itself, it will determine whether a doctor can progress to the next stage of training.
When a doctor reaches FY2, they will require a full registration with a license to practice. And to aid with this transition, the program directors at the Trust will arrange several one-to-one sessions where individuals can complete any training applications, portfolios, or interview preparation. The year will also include taking on increasing responsibility for patient care, making management decisions as part of the progression onto independent practice, developing core generic skills, contributing more to education and training, whilst demonstrating clinical effectiveness and leadership all the while. Meanwhile, in November of FY2, a doctor will be able to apply for specialty training, such as in general practice, core medical training, or core surgical training, to name a few. Alternatively, a doctor may choose a subspecialty, such as pediatrics or radiology. Some are run through, meaning that doctors only apply once, before continuing with training until they become a consultant, whilst others, such as core training, involve doctors applying for a specialist training job in another 2 to 3 years.
At the end of FY2, doctors are awarded a Foundation Program Certificate of Completion, known as the FPCC. After this, doctors may choose to enter core training, a specialty or a general practice training program. But there are also many cases whereby doctors have pursued other interests, such as voluntary work or academic research. For example, they may choose to take a few months or even a year off in what's known as an out of program, during which time they may carry out a research project, get involved in teaching medical students or doctors, or may simply choose to spend some time abroad. Either way, the choice is completely yours as a doctor. The world is now your oyster.
Thank you for watching. Make sure to like, comment and subscribe, as we'll be posting more videos in the future. Once again, thanks for watching.